When water breaks or there's the show, how long does it take? So to avoid panic, because sometimes like the water broke and then you're panicking, you think that the baby is going to come in the next 2 minutes. Yeah.
Usually when the water break, we advise the woman should go to hospital straight away.
Mm-hmm.
Yeah, because there is high risk of getting infection and other issues.
Okay.
Then when there's passage of show, one can actually wait till you have the contractions begin.
Maybe you can address the issue of why or when vaginal delivery rather is not possible.
So thank you for that question.
Yeah.
Sometimes the birth plan can be vaginal.
Yes.
And then during labor, complications arise.
Mm-hmm.
So I think during these kind of scenarios, the woman should be ready and should accept to get cesarean section as an option.
A lot of debate on vaginal delivery versus the C-section. Which one is better? Are there benefits of vaginal delivery versus the other method? Hello and welcome to the Purity Afya Show. If you're new here, we talk about women's health, we break stereotypes, we have informative episodes with experts and women sharing their wonderful health stories. So please remember to like, share, subscribe. You are yet to do so. My name is Purity Afya. Now today we talk about something that any woman, a process rather, that any woman who is looking forward to having children must go through, and that's delivery. We have two types of delivery. We have the vaginal delivery and the cesarean section. Dr. Stephen Mutiso is kind enough to take us through these two processes, but we want to break them down and begin with the vaginal delivery. Don't forget to subscribe and also look forward to the next episode next week on the cesarean section. So without much ado, let's get started. Daktari, thank you so much for being here.
Thank you for having me.
Yes, and for a first-time mom or someone getting pregnant for the first time, there's so many fears, there's so many questions about delivery. So let's begin with the vaginal delivery. What is it? What does it involve? What sort of preparations? But let's just basically define what it is. What kind of a process is this? And like, what does a woman go through when they are undergoing the vaginal delivery? Yes.
Okay, thank you so much. So vaginal delivery means birth of an offspring.
Yes.
Through the birth canal. So it means the baby comes out through the vagina.
Mm-hmm.
So that's what we call vaginal delivery.
Yes.
Sometimes it's referred as normal delivery.
Yeah.
It's vaginal delivery.
Mm-hmm.
Yes, yeah.
Okay. So now let's talk about preparations, because I know sometimes you would prepare for the vaginal delivery and then things happen and your doctor tells you need an emergency CS, but with all other factors not considered, how can a woman prepare? Is there a way you can advise a woman? How do we prepare for a vaginal delivery?
So usually what happens is during pregnancy,
yeah,
women attend antenatal care.
Mm-hmm.
And during the clinic, we are able to assess
Mm-hmm.
and see whether vaginal delivery is the best option. So most of the time, when we make assessment, we find the woman is actually eligible for vaginal delivery.
Mm-hmm.
So there are many things we look at, like, for example, how the baby is presenting, which part of the baby is actually coming first. We also look at the size of the baby. We also look if the baby is healthy. So if we find all these things are okay, and also we also assess the mother in terms of the pelvis,
Mm-hmm.
whether the birth canal is sufficient. So when all these things are okay, then this is the time we allow vaginal delivery to take place.
Yeah. And
Yes.
at this point, you look at these things, I assume, during the last trimester, right?
Yes, exactly. Yeah. We look at these things. Mm-hmm. We do the evaluation usually around 36 weeks, 38 weeks. we should have a good birth plan. We know which way we are going.
Yes.
Yes, yeah.
And a lot of debate on vaginal delivery versus the C-section. Which one is better? Are there benefits of vaginal delivery versus the other method?
So vaginal delivery is considered to be the best option.
Mm-hmm.
And it's because of usually the recovery is a bit faster.
Yeah.
And also in terms of costs, because it's usually much cheaper than a cesarean section.
Mm-hmm.
So we promote vaginal delivery as much as possible. But on the other hand, when there are indications for cesarean section, then again, this should be acceptable. It's also equally safe.
Mm-hmm.
Yes.
Because there are families, I'm sure you've encountered such families that some women or children have even lost their lives because they do not want the CS, they just want the vaginal delivery. Maybe you can address the issue of why or when vaginal delivery rather is not possible.
So thank you for that question.
Yeah.
Sometimes the birth plan can be vaginal.
Yes.
And then during labor, complications arise.
Mm-hmm.
So I think during these kind of scenarios, the woman should be ready and should accept to get cesarean section as an option. Mm-hmm. Otherwise, things can also go very wrong.
Yes.
During vaginal delivery. Mm-hmm. Yes, yeah.
Okay, so let's talk about the different stages of labor. Because you have to go through labor so that now the vaginal delivery can happen, and this will also help women at home, because sometimes you are a first-time mom, you don't know when you're almost delivering. So that's why we've had so many cases of women delivering at home or even before getting to the hospital. So take us through the stages of labor, Doc.
So the stages of labor, they are usually 4. So I'll go through them.
Yes.
But it's important also for a woman to know when actually they're in labor. So usually the first signs include regular contractions, regular pains, sometimes 2 times or 3 times in 10 minutes.
And let me cut you short.
Yes.
Braxton Hicks.
Yes, yeah.
And the normal pain for labor. How do you differentiate the two? Because some women, like, you just have those hicks and then you run to the hospital. Then your midwife tells you, go back home. Yeah.
Yes, yeah. So Braxton Hicks are actually false pains. Mm-hmm. And they are not very regular. It may happen once and then there's a break of a very long time. And sometimes they are also short. Sometimes they just tighten and there is very minimal discomfort. Mm-hmm. However, contractions or labor pains, they are more frequent. You find in 10 minutes one can have 1 to 3 times. So actually, it's labor pains because they are frequent. Mm-hmm. Yes, yeah.
And how frequent are we talking about here?
We are talking about probably 3 contractions in 10 minutes. Okay. Or at the beginning, this may be less, but as labor progresses, then you end up with 3 contractions in 10 minutes. Mm-hmm. Yes, yeah. Okay. So if the contractions are frequent, then it means it's actually labor. It's not Braxton Hicks. Braxton Hicks, one can have an episode once in a day or one in an hour. That would be Braxton Hicks.
But are they a sign that labor is somewhere around the corner?
One of the things which may happen is a passage of shore. Some mucus stained with blood, because that means the cervix is getting ready, it has started opening, and that's why the mucus plug has come out. Mm. And then we also anytime there is drainage of the amniotic fluid which surrounds the baby, again, that means labor is almost about to start, and the woman should actually go to hospital. Mm-hmm. Yes, yeah.
So when water breaks or there's the shore, how long does it take? So to avoid panic, because sometimes, like, the water broke and then you're panicking, you think that the baby is going to come in the next 2 minutes. Yeah.
Usually when the water break, we advise the woman should go to hospital straight away. Mm-hmm. Yeah, because there is high risk of getting infection and other issues. Okay. Then when there's passage of shore, one can actually wait till you have the contractions begin.
Okay.
That should not be scary at all. Passage
Yes.
of show, yes.
Yeah. Doc, sometimes water breaks. You have all those, but then labor prolongs. It takes time. Like you hear some women say they labored for just 5 hours, others 12, others even 24 hours. Are there causes for that? Are there contributing factors?
Yeah, duration of labor depends on person to person.
Yeah.
And then it depends on also many other factors, including the size of the baby, the position of the baby. So there are usually so many factors which come into play. So that's why we have kind of a range. Yeah, we normally say baby thinks labor is prolonged if it has taken more than 24 hours. That's when we say it's really prolonged and something needs to be done. Yeah. Otherwise, some people have it easy. It can be very fast.
Yes.
Others have to labor for a bit a longer time.
Yeah.
Yes.
And there are some cases where after the prolonged labor, experts, you advise that the woman maybe there's inducing. Let's address the issue of inducing, and also the issue of advising now the woman to go through the emergency CS, because it's a bit painful that you've labored and then at the end of the day you just go through the CS. Yeah.
Okay, let me start with the induction of labor.
Yeah.
Induction means we are starting the labor ourselves. The woman is not in labor, so we are starting. There are reasons why delivery needs to happen, and that's why we are starting the labor. So there are usually indications for this. Common ones would include probably serious diseases, complications of pregnancy, which can affect the mother of the baby, like high blood pressure, maybe diabetes. Or there are times when maybe the baby is not growing as well as expected, or there are times when the pregnancy takes too long, what we call postpartum pregnancies. Yeah, so in these cases, the woman may be advised actually to undergo induction. So it's a process of starting labor using different methods. Of course, the commonest we have is there are some drugs we use. We call them prostaglandins for insertion. Sometimes there are solutions or tablets we use. Sometimes we use even catheters. Yeah, so that's induction.
Yes.
And then when one is in labor, sometimes the contractions, they are not very good. So sometimes we make them better, and that process we call augmentation of labor. Then, as I said earlier, sometimes the plan may have been vaginal delivery, but during that process we find there are complications. A woman is in labor, but certain things are not going correctly. Like, for example, if labor is getting prolonged, then that's the time we may advise C-section. There are situations where also the baby may get tired, what we call fetal distress. You find that bit is not okay, and if you don't do something, the baby is going to die.
Yeah.
So C-section becomes the fastest way to have the delivery.
Yes.
And there are also many other issues which can happen, like bleeding may start during pregnancy. Sometimes the contractions may be too strong, and we think if we don't deliver quickly, you may have what we call uterine rupture. Yeah, so there are many reasons why sometimes we change the plan. Yeah, and then the woman has to have emergency resection. Yes. Yeah.
And I know we'll have a time to talk about complications during pregnancy, but Doc, you mentioned a few issues that I picked. For example, the baby is distressed or prolonged pregnancy, like it's after 40 weeks and still no labor. Are there known causes for that? Like why I would be planning for a vaginal delivery and then all of a sudden I go for a scan and then the baby is just tired.
Yeah, so usually during labor there are a lot of things which happen. Sometimes we make the assessment when one is not in labor, but during labor sometimes it's very difficult to predict how the baby will respond to contractions. What we are talking when we have contractions during that period, actually the baby does not get sufficient oxygen during the contractions. So you can imagine if the contractions, for example, they are more than what we normally expect, or they are taking too long, a contraction is getting too long, it's taking too long. So you find in those situations the baby may have problems. There are also situations where probably the placenta is not functioning very well. So when you get the stress of labor, then we start the baby starts manifesting that they are not able to tolerate.
Yeah.
And then there are certain positions, if the head gets into the pelvis, in certain positions, labor may become very difficult. Usually the normal position is the babies get in when they are facing backwards. But sometimes if they get in when they are, for example, facing the front, then again it becomes a big problem because of the big diameters of the head. The head cannot pass through.
Yeah.
So these things can happen. Yeah. And of course, sometimes the emergencies are extreme, like sometimes the cord can actually come out. Yeah, and this becomes very difficult.
Yeah.
Or sometimes the baby even the hands may come out or the legs. So it becomes very difficult to proceed with vaginal delivery. One has to do emergency section to save the baby.
Sure.
Yes.
And how about what is the explanation now for the delayed contractions where you are past term?
Yeah, post-term where you go beyond
40 weeks.
The dates, sometimes up to 41 weeks, and nothing has happened. Actually, most of the time we don't know the reason.
Okay.
Yeah, we don't get to know the reason why some women don't go completely into labor. Yeah, so this is an area still under investigation.
Yeah.
Yeah, but of course sometimes we have problems with the babies themselves.
Well, the babies, African moms, you see the baby is so comfortable in there.
Yes, yeah, but really we don't know. We don't know very well why sometimes this happens to some pregnancies.
Yes. Now let's talk about labor pains.
Yes.
There are women who, once they are pregnant, like you're so scared, you don't know how that day will be. It's like the second coming of Jesus. Like you're so scared, you don't know. How much for someone who has never had a child, it's a first time, how much pain is this, and does this pain differ in terms of, for example, I had my first baby. Do I expect the next pain when the same pain when I'm expecting the second baby, or it could be severe? How severe is this pain?
So thank you for that question about severity of the labor pains.
Yeah.
I think labor is painful. That's the truth, and it's good to prepare right from the beginning. The only good thing is it's for a time. Yeah, one is able to go through after some time.
Yeah.
Yeah, but there are ways actually to try and make it better. Like during the antenatal period, we normally recommend women to be active physically. This increases perseverance during labor. We also recommend they do a lot of exercises. The pelvic floor exercises, squatting, swimming. These things are important. It increases resilience during labor. And then during labor, we recommend things like walking around. Sometimes if there's a partner, can help rub the back. Sometimes we give drugs to try and make it less. And of course, we have also this new concept of painless labor, where an epidural is given, not so common, but it's still an option of painless labor.
Tell us more about it, Doc.
Yeah, the epidural is usually it's a choice one can have. It's given at it's a drug administered usually at the back of the patient of the woman, and this relieves pain. Of course, it has its own issues because number one, we need anesthetist, and we don't have so many who can do this and actually be there physically present actually during this period, so that they can monitor and top up. Yeah, but it provides a relief. The only issue is when it comes to the second stage of labor, when one is the baby is supposed to be born. The pushing, that part of pushing. Yeah, sometimes that stage becomes more prolonged because the pushing aspect is actually affected. Yeah.
Okay.
But I think it's one of those options. Probably with time, it may become more available.
Yeah.
Yes, for many women.
Doc, you mentioned that you advise women to be active, exercise, but there are women who, from the onset of their pregnancy, they are put on bed rest, total bed rest. Can they still do these activities, or does it mean now they will probably go through CS?
Yes. Thank you for that question. At times we advise bed rest depending on the complications. Yeah, but generally, if everything is okay and there are no complications, we normally encourage very active lifestyle during pregnancy.
Yeah.
Yes, yeah.
So in other words, a bed rest mom will most likely go through CS?
Not a bed rest mom, not necessarily that they'll go through CS.
Okay.
But we only recommend because we think bed rest may be useful in actual treatment of the problem they have. Yes, yeah.
Okay, Doc.
Yes.
So let's not talk about essentials. What should a mom be carrying to the hospital for themselves and for their babies, and what should they expect? Because you're staying in the hospital probably for a day or two, so that they avoid those mistakes.
Okay, thank you. So every pregnant woman should have a birth plan by around 34 weeks, 36 weeks. So the birth plan includes knowing the place where one will deliver, and the course and how they'll get there. So it's important to be actually in consultation with the facility, so that the items required, one is told the things which the hospital may provide and the things the woman should come with. But generally, in terms of preparation, they'll need to have a bag ready, and this bag should have some personal effects, like the toothbrush, toothpaste, things like this. Maybe a cloth to change. Most of the time when admissions are done, when they go for delivery, they'll be given hospital gowns, clothes to wear on. So at least you need to have something to put on when going home, back home. Then we should have a few essentials for the baby. Maybe a small pack for all the pampers and a few clothes for the first few days. Yes, yeah. Yeah,
and this question is now maybe addressed to the facilities and also the experts, because there are also those fear of complications during the vaginal delivery for both the mom and the baby. Some babies, I've had stories where they developed some defects when they were being born, okay? Then for moms, there are those fears of tearing. So how do you address that? What causes the tearing? Because for some mom, it's a serious tearing. We also have issues of fistula that women develop when they, especially, I know that's a different topic, but we can address that, and the fear as a mom of, okay, my baby can develop problems when being delivered through VBirth if not handled well.
So sometimes the vaginal delivery can, sometimes complications may arise. So the delivery may happen, but the mother ends up with certain complications.
Yeah.
So some of these complications may include perineal tears. Sometimes they are severe to an extent where the tears may extend maybe all through the vagina and the anus, what we call 4th degree perineal tear.
Yeah.
Sometimes there's bleeding, which may happen again from the tears, or sometimes the placenta may not come out as expected, and this may mean probably removal in theater. There are also issues of bleeding which may also happen, what we call postpartum hemorrhage. And then in the long run, there may be other complications like problems with damage to the muscles of the pelvic floor.
Yeah.
So you find the whole perineum is lax, and sometimes they may have urinary incontinence later in life, or even sometimes the pelvic organs may come out. So these are some of the complications which may happen during vaginal delivery. And of course, you have talked about fistula, obstructive fistula. This may also happen, especially where labor is very prolonged. One has labored for too long. It's a complication which may arise. The
bleeding has killed so many women. I think the last time I checked, it was the leading cause of maternal death among women. Can that be prevented?
Yes, postpartum hemorrhage, bleeding after delivery, yes, it has killed so many people. That's why we recommend deliveries should happen in health facilities. It becomes more easier if such a problem is there. The facilities can do something about it, and if they need to refer to probably higher facility, it's easier done from health facility. You find in terms of time, it's easier rather than somebody coming, for example, from home.
Okay, Doc, thank you so much. Let's wind up. What would you tell a woman watching and they're pregnant or looking forward to getting pregnant and they're so scared of the birth process? What is your message as an expert who has handled so many women? Because most of us pray for, the Hebrew delivery story. We want it to be painless and very fast. I
would like to encourage pregnant mothers. I would like to inform them that when possible, vaginal delivery is the best, and it needs to happen in a health facility with skilled birth attendants. There are modalities to try and reduce the pain associated with labor. And generally, if everything goes well, it's usually the best in terms of recovery afterwards. So they should not be afraid to have the normal birth.
Okay, Doc, thank you so much. Well, there's something Doc mentioned that labor pain is severe, but it just comes for a short time. It's not like 3 days or something. It comes and passes. And of course, when you see your bundle of joy, you forget everything. Thank you so much for staying with us. Next week, we are talking about the C-section. Please put on the notification bell. Also, remember to subscribe, because we also want to learn next week on when to choose the CS, when it's advised, what are some of the pros and cons, and how to manage yourself as a mom after the C-section. See you then. I am Purity Afya Show. Bye-bye for now.